Good afternoon. Appreciate everyone being with us today on this Sunday. Things are actually, we've got our state count today, and it seems like we're averaging about 100 plus every day of confirmed cases. Since yesterday, we've got 600 confirmed cases in the state of Georgia. We had 507 yesterday. Today we have 23 deaths. That's up from 14 from yesterday. Have 2 in Whitfield, 1 in Chattooga, 9 in Floyd, 4 in Gordon, 57 in Bartow. The reason I read you these counties, if you have just tuned in here in the last few days, these are counties that are closest to us. These are our Northwest Georgia regional counties. There's 15 counties, and as we are one of those. And still the largest impacted group, age group, is 18 to 59, and they're still standing at 42%. The next affected age group is 60 plus, and we're at 31. We are at 31%. We're also monitoring Tennessee and Alabama. Tennessee right now has 371 confirmed cases, 7 in Hamilton County, with one of those real close to us in Lookout Valley. Have 1 in Bradley County. Alabama has 138 confirmed cases. One of those are in Jackson County, which is from Bryant, which is just, like I said yesterday, that's our neighbor. 12's in Madison County. The numbers are rising, as I mentioned, every day, and that they will keep rising because the test kits now, they're becoming more and more available, and those numbers will change. We had, I mentioned yesterday also, about the banks, and this is important. Some of you may have not heard this, but Citizen Bank and Bank of Dade, they issued a statement yesterday that I read aloud, and they are closing the inside of the bank. They're still going to actually have your drive-through, and also you can call, like if you're applying for a loan or whatever, you call the bank there, and they'll help you. They're still going to maintain the banking operations. But it's going to be a remote type transaction. We had, let me see here a couple other things before I go into that. We had talked, I think it was 4 days ago. My days are mixed up, but maybe Tuesday or Wednesday, possibly about a declaration of our local emergency, our county, and our commissioners, we've talked about this. Alex, he's here with me, the mayor, and we've decided to go ahead and actually I'm going to sign this declaration. It'll actually be effective tomorrow. This will give us a kind of an upfront, put us up front as far as any funding that'll be available through federal or state funds, and a number of things that'll cover. It's a similar thing, real close to a similar declaration that we did back when the tornadoes hit. Because things are not getting better, they're getting worse. We've actually, today, when we leave, actually when we sign off here, we're going out front here, and Carrie's going to try to follow us, and we're going to show you something that we've been working on all day since daylight this morning. I had a glass company come in, and we've got this building tomorrow. The inside will be closed. We'll be here, the employees will be here, but we're changing the way we're doing business as far as similar to the bank, similar to what our banks are doing. And we have 2 outside teller windows now. We have one when you walk up to the front door to your right. It's actually for the tax commissioner, and all your titles, taxes, your transactions will be taken care of there. We have one on the left where the actual voters registration office is at, and we will handle all other county business. We'll have actually a ringer out there, a button where you can push it, and we will be notified. If you have a problem with a tax assessor you need to talk to or whatever. And we'll also have phone numbers posted out there that you can call that office before you even get out of your car. And if you need something to do with our commission office, whether it be electrical permit, whatever, we can handle that right there through that teller window. And that'll not only protect you, it protects us too, and anyone in the building. So we'll do that at the end of this. I have Alex, of course, with me here, and have Robert Goff. He wants to speak to you too. So that's pretty much everything I've got right now. as far as any type of changes that's happened since yesterday. Just try to maintain your, as Lamar was showing you yesterday, your hand washing and just the basics. Use common sense, and we'll try to fight this thing, and hopefully things in the next week or so will turn around to the positive, and we'll be here talking to you, and maybe a little smile on the face. But until then, we'll be here at 3 o'clock every day, 7 days a week. And I do encourage you, as I do every day, call us. Call 24/7 is my number. Call me if you're just sitting there and you're just thinking about something you need an answer to. And if I don't have an answer, I promise you I'll get it for you. And so, Robert, you want to come on up? This is my vice chairman and commissioner, Brother Robert Goff, and he's got a few things he wants to share with you.
Thank you, Commissioner Rumley. I'd just like to say that we are going through some things that none of us have ever seen, and we pray that we never see them again. But the fact that we keep having to reiterate the goal is to slow things down, and that's why people are being asked to do the things that they're doing, and the things that we're doing here with the county with these windows that are going in all over our county and in our businesses. And my wife has been on the phone the last few days with her doctor and appointments and protocol that they're going through in Chattanooga where she goes to the doctor. This is something that's just hit every walk of life, business owners, everyday people, sports, movie industry. It's just something that has gone beyond anything we could imagine. But the goal is to slow it down, and is if people can stay at home, to stay at home, stay out of crowds. And I was speaking to a friend of mine that happened to be in the U.S. Virgin Islands yesterday, and on that little island of about 5,000 people, I think they've got 2 cases, and that sounds like such a small amount, but when those 2 are out and about, if they're not quarantining themselves. So we just ask everybody to be safe. And it's Sunday. It doesn't seem like Sunday to me because this is the first Sunday I have not gone to church in, I can't remember when, unless I've been on vacation or some reason been away from my church. But I will tell you, many of the churches, they don't want to do what they've had to do or what they felt they had to do, but they are live streaming their services as well. And if your church is doing that, you're still able to keep up in your faith and in your church. And we just hope that, we talk here about the technology we have, that it hadn't been but a few years ago we wouldn't be able to come to you the county-wide and even beyond the county with the help we have from Evan Stone and his radio and television station, to be able to even go on beyond Dade County. But the technology is there, and we're thankful for that, that it is. So we're doing everything that we can. Chairman Romney said the numbers will be posted. If you need anybody, you're going to get the help you need, the help that you deserve, and the help that as far as tags and paying your taxes here and anything they're in this office. And I know Alex with 911, they're working hard, Puckett Ambulance Services, everybody. But again, it's to slow this thing down so that we don't continue to carry it out, and hopefully within another week or so we can come back, as Chairman Rumley said, with a smile on our face by that time and say things are on a downturn. We've been very fortunate so far. We don't know of any here in our county, and we hope and pray that does not happen, that anybody's tested positive. Was some good news last night on the national news that some company had come out with a new test kit that would take about 45 minutes to determine if a person was carrying this virus or infected by this virus. That's a plus because it was taking longer, and they will be able, I think they said, to hit the market with those, begin to deliver them within the next few days, maybe even as early as tomorrow. So there's some good things happening, some good positive things happening, but in the midst of something that we just can't imagine, we hope that you stay safe, that you stay in as much as you can, do the social distancing and everything that we're being asked to do. We don't understand it, but it's here. And again, we just hope that everybody stays safe. Our prayers are with our elderly, but as we're seeing with these statistics that are being read, it's across every age group from 0 to the oldest people we have. So stay safe. We keep seeing on some of the things, it's be prepared and not scared. We don't need to panic. We just need to work this thing out. We need to just float it out together, and we will come out on the other side. And I think we will have learned a lot in this that will help us if and when there's another pandemic of this kind in our country, in our communities, in our cities, in our towns across America. We will learn from this, and that's a good thing. So thank you again for tuning in on this Sunday afternoon. I'm going to ask Mayor Case to come on up. He has some things to share, and then we will be going out in a little while and showing you what the county's doing that Ted talked about a little bit earlier.
Good afternoon, everyone. Again, I'm Alex Case, Mayor of the City of Trenton and also the Director of Dade County Emergency Services. Hope everyone had a wonderful Sunday morning. I know a lot of the churches went live stream through Facebook and YouTube. I watched our church service at Trenton First Baptist and then surfed through and seen some others. I was very excited that everybody has that and that we're using this technology to still get the word out. It was good prayer with our church, seeing how many was there and feeling that we had our church family there and our preacher and our singing. It was really nice. So glad everyone and hope had a great day. One of the questions has come up several times with the City of Trenton and Dade County, and we have spoken to this. Also with our regional mayors, our EMA directors, our 911 directors about what restaurants and what City of Chattanooga has done. Fort Overthorpe will have a resolution going into effect 6 p.m. tomorrow night. City of Trenton commissioners and myself have individually spoken. They have seen Fort Overthorpe's resolution. We are going to try to move forward for that, but again, it is just stopping the in-person dining for these restaurants. Carry out and drive-thrus will still be available. A lot of restaurants have already done this. They've either closed down totally or they are still offering these services. Tennessee just done something, I believe, last night as well. We, again, talking with our counterparts, we're going to look at Tennessee's. They went back with some of the CDC regulations. If you can social distance inside less than 10 people in a gathered room, you'd still possibly have the in-dining. So we want to go back and research that. We did write some draft resolutions and get something we're thinking about to stay ahead. The reason we're saying this because we are slowing this pandemic down. I had a question asked to me. Me and my wife was discussing this last night, and I've read so much every day on this, trying to stay up from our state office of Emergency Management and what we're getting daily and everything from CDC and public health. But one of the biggest things that we're trying to do is really slow the sharp curve down of what we're from the infection rate. And here in the things between, and we hear a lot of the talk about the common flu and about the COVID flu, COVID-19. Your regular common flu has a infection rate of 1.3 people that may be infected from you if you were out and about and shouldn't be, or you didn't know you have it. So, and then the incubation period of the regular flu goes from 1 to 4 days. Your COVID-19 is 3.4 times more infection rate to a person. And then it has a 1 to 14 day type symptoms that can be around. Another way it was looked at, and I researched this from several things, on a regular common A and B flu, 1 per 1,000 of a fatality rate in last year's numbers from the flu season nationwide. Currently from China, Italy, everything that's to date and projections, COVID-19 has a fatality rate of 10 per 1,000, so it's 1%. 0.1% of their population on the regular A and B flu or common cold with respiratory infections to 1% of the COVID. So it ain't that it's here, it's going to continue. The numbers are around our county, and we will have something in our county soon. We're just trying to slow the rate down. And to say that we're slowing the rate down so our healthcare hospitals can take care of us. They can take care of the elderly that does have the infection rate, or the age groups that do have COPD, lung issues, heart issues, diabetes. Our hospitals cannot handle the inundation of a sharp curve of us not doing our part to help slow this down. Again, it's here. It's a year to a year and a half for any type of flu vaccination for this. They've talked about other things they're trying to do, but the problem is, what we've got to do is we have to self-isolate if we have any of those symptoms. Again, I mentioned yesterday how much pollen is out right now. Our sinuses, our sneezing and coughing and things, over-the-counter medications. Most of the people that do have those symptoms and start doing their fever at the low-grade fever, you're treating with over-the-counter fever reduction and hydration and staying hydrated and flushing this out. And if somebody is in contact with someone that is possibly tested positive for COVID, or maybe they were around them and 2.5, 3 days later they find out they're positive, they need to kind of isolate for at least 7 days to make sure they don't start showing signs. That is the big reason why Commissioner Rumley and Goff explained that we will be closing to the public, but everything you need to do here for the county, we can do 99% of everything through the phone and using our teller lines we'll show here shortly. So again, when we were talking about that last night, and then me and my wife started doing some research, and it's the common question, why? The why is that it's got more of an infection rate than the common cold. We need to slow this curve down. We've mentioned this several times, so our healthcare, EMS, hospitals, clinics can handle the influx of this. Some of the older folks are having to go on respirators, and there's not enough of them, breathing machines, there's not enough of them, and we got to really watch this. And some numbers I heard from another doctor on through CDC is that nationwide there's a little over 100 and something thousand ICU rooms nationwide, United States. Daily, 60 to 65 of those are used for common type ICU situations, which leaves us 35 to 40,000 extra. So that is why the hospitals are very strict about this. Another thing that is what we are currently doing is a question that was asked to us a while, and I would like to reiterate, since one of the Marion County case that is positive, the ambulance service that is contracted for Marion County, Sequatchie County, Dade County, Walker, and Catoosa County is Puckett EMS through Priority Incorporated. Actually, 2-3 months ago, with their dispatch, all the 5 counties between Tennessee and Alabama and Georgia, we started working on questionnaires in our 911 centers, asking questions of the travel advisor, which was put out after China's thing when it started in 19. Then President Trump also initiated that, and a lot of help through our services. We said we need to come up with some better questionnaires, for these type symptoms. We've done that, have been doing that. We've actually fine-tuned that even more since it's more inundated inside the United States and in the area. So we constantly, with that task force of EMA and 911 directors, a lot of times we're the same folks, and of those 4 counties we are. And one of the things with Puckett, being with our provider and with Dade County EMS, we've taken extra steps with personal protective equipment. Puckett does have some decontamination equipment at their headquarters on Russell Boulevard. So any equipment back of an ambulance that is confirmed or contaminated, they're stripped, they're completely clean with electrolysis type cleaning materials that puts this out, and it really grabs onto the metals and the surfaces, and it's clean from head to toe, in and out. But CDC also says, as we have these questions and we ask them, and we do feel they meet a criteria of this, personal protective equipment, goggles, face shield, mask, gloves, gowns is what everybody's wearing. And as long as you have those, no body fluids or anything they're perfectly fine to continue on. That's why we've got to slow the curve down so these healthcare providers can go out and get the people that do have the severe chest pains from the congestion and the fevers and got to have that help. We've got to get to them, but we've also got to look at if they are positive or to that effect decontaminated our equipment, because we have, between the ambulances, if we get too many into that situation, we have to hurry and do that. And I just didn't mean to touch my face there, but anyway, that's what we're doing. I encourage you also, if you have doctor's appointments for your family or yourselves, please call them. Make sure that they're doing. A lot of different issues have come up, as Commissioner Goff had mentioned. I want to remind everyone, also, Commissioner Rumley mentioned the state of emergency that we will be signing for Dade County and the City of Trenton, as we do for the MOU of emergency management. He mentioned we've done this back in 11. We've done it also in 13 when we had our floods and several disasters that have hit us small. What this actually allows for us to do is to work with state, GEMA, and FEMA to give us access to necessary funds for supplies as needed to protect the county's police officers, sheriff's departments, EMS, volunteer fire departments, that we've already made those requests. Some of those supplies will be coming in. We've got another conference call this evening with the Department of Public Health on the strategic national pile that FEMA has said is there. It's coming into the state, and state's distributing. It also allows us to perform and exercise our emergency actions necessary to promote the security, safety, and protection and well-being of the people of Dade County and the City of Trenton and our visitors. There's just, in our operations plans and our ordinances, that we have to have for FEMA and GEMA to help us get through these things and mitigate projects that we do. It just allows us to continue to do that, which our main focus on this is to allow us to focus on the efforts to slow the spread of the COVID-19 and maintain essential works for the county and the city and the other businesses. So that's what the state of emergency will do for us. It invokes our emergency operation plan, and there's a lot of different things in that plan. We don't have to use any of them. This is just helping us get to that point where we can. And we're daily in contact with our state, and then what the federal is going with public health. And I'm going to remind everyone, we have a number that if you can't remember, 657-HELP, 4357, 706-657-HELP. That will call into our main phone system in Dade County, and it'll have a number. I'll give you an idea of press 1 for the sheriff's office, 2 for the commission office. I'm not sure if that's the order, but if you don't want to remember the number or each individual number, it'll move you. But if it's an emergency, please dial 911. Also, if you have a question, by email, info@dadecounty-ga.gov or info@dadesheriff.com. Either one of those can be answered, and questions back as quick as possible. Both the public information for the county and the sheriff's office will get back with you on that. But remember, if you want to remember one number, 657-HELP. That's all. Thank you.
Thank you, Alex, and thank everyone for listening today. And stay tuned to us. As I said, this is local. And do what, Evan? Go ahead. Yeah. You want to say something? Okay. All right. Just come on up, Evan. Evan's got a couple of things he wants to share with you, and we'll ease on out.
All right, just talked with Dr. Harris just a few minutes ago, and she would like for me to go over the distribution of school lunches for tomorrow. They're doing this 2 times a week. They're doing it on Mondays, and they're doing it on Wednesdays. Same schedule for last week will come up this next week. And what that would be, in Dade County, if your child rides a bus, they're going to be running buses on all the routes 4 hours later than you normally would get on the bus. For instance, if your child meets the bus at 6:20, then 4 hours later at 10:20, give or take 15-20 minutes for a window of time there, that's when they're going to be coming by to deliver the meals at home. They will be 2 meals that will be given out for 2 days. So they'll get a lunch and a breakfast for Monday and Tuesday.
So the buses will be running 4 hours after the initial drop-off or pickup time in the morning. So once again, if your child gets on the bus at 6:20, it'll be at 10:20. Now, if your child does not ride a bus, both the elementary schools in Dade County will be open tomorrow from 10 until 1 outside for meal pickup, excuse me. So you can go by, you don't even have to get out of your car. They will bring it to you. You'll get 2 lunches for Monday, and or 2 meals for Monday, 2 meals for Tuesday. They will be doing this on Mondays and Wednesdays until they get back into school. So she wanted me to in this briefing to go ahead and tell everyone, remind everyone, tomorrow is Monday. You got 3 on Friday. You'll get 2 tomorrow and 2 for Tuesday, a total of 4 meals. And the bus routes, it'll be 4 hours after your child would normally get on the bus. Say, once again, 6:20, you're looking at 10:20. And then the 2 elementary schools will be open from 10 until 1, from 10 a.m. until 1 o'clock. You don't even have to get out of your car. Just drive through, and they'll be happy to hand you the meals through the car window. And that's they just want to make sure that you remember tomorrow is a meal pickup and drop-off day for Dade County schools.
Okay. Thank you, Evan. That's good information. As I was saying, I appreciate everyone tuning in. We'll be back in touch with you at 3 o'clock tomorrow. I do want to add a couple of things. You know, I don't think we said this directly, but there's no confirmed cases at all in Dade County yet. Now, there are some people that's being tested, and as soon as we get those results back, we'll let you know. Hopefully we'll have an answer by tomorrow, but right now there's no confirmed cases. And what we base our information off of is directly from our Department of Public Health. They notify us immediately when, or the other counties have been notified immediately when there is a person that tests positive. So there's a lot of rumors, a lot of things starting out in the county, but that's why I stress to you to try to tune in to us, or Evan carries. I think he's carrying it live today on his television station, and also I think radio. So and there again, we try to cover. We throw a few counties in here other than ours. It's in our region, but this is real Dade County stuff here, and this is real. And we don't hide anything from you because you need to know what's going on. And so we share that. And as I said the other day, if anything happens, drastically, we need to come back on here an hour from now or 3 hours from now. Carrie will put that out, and we'll be right here and update you on it. I don't foresee that happening, but just want you to know we do appreciate everyone bearing with us on this. And we'll be here tomorrow at 3 o'clock. So thank you for watching this. And we're going to ease outside now, and we'll show you what we've done since before daylight this morning. We started on this little project, and we'll show you kind of a routine that we're going through right now. It's on right now, yeah. Here, if you come out here, many of you, most of you have been to our administrative building. And when you walk up to the front, this is what you see. Okay, it looks normal, but you come on up, Carrie, and we'll show. When you get to our front doors now, there will be signage here directing you left or right. Come on up, Carrie, and show them right here. We've got a teller, an outside teller window here. And we also have one. This is the tax commissioner's office, and this is actually voters restoration. The tax commissioner's office, they will be handling strictly tax purposes. Tags, titles. They'll take care of business right here. We'll have a signage out here with all the phone numbers. You can call them, call us. This window over here will actually be for our side. We'll be using it for commission purposes. Tax assessors, anything pertaining to anything other than the tax commissioner. So it'll be a little different when you come to see us. If you come in tomorrow, we will try to have, we'll have temporary signage out tomorrow, but we got some permanent signage that'll probably be here Tuesday. That'll be out here, and be real easy, simple, be just a little different, you know. So we appreciate everyone. And Alex, you want to add anything?
Yeah, just remember the 706-657-HELP, and that will get you to any of these offices. We also have signs out here with those numbers. We'll have 2 doorbells that will ring back into those offices as well, just to help you. But again, if you can call or email 706-657-HELP or info@dadecounty-ga.gov.
That's right. And of course, if you can't remember that, my phone number is 667-8999, area code 423. And a very easy number to remember and easy number to find. So we appreciate everyone, and we encourage you to call us if you've got any questions whatsoever. We're just trying to let you know that, you know, we're with it. We're with you all the way through this. I mean, if it's going to take 2 months or 2 days or whatever, we'll be here and try to keep you informed on really what's going on here. Okay. So thank you so much, everyone.